Hi everyone, welcome to today's episode of Aesthetics and Wellness by Dr Yusra. On today's episode, I have Dr Hassan Yassin, psychiatrist, and we have talked today about body dysmorphia, appearance anxiety, and given some tips on compassion and how to manage these concerns. I hope you enjoy. Hi, welcome to the podcast.
Hi. Thanks.
So, for those of you who don't know, Dr Hassan Yassin is a child and adolescent psychiatrist who works both in the NHS and privately and sees patients from all walks of life, including adults. He also does Section 12s, tell us a little bit about you and your background and some of your training and experience.
So I work in child and adolescent psychiatry. That's predominantly what I do most of the time, which is treating young people under 18 for a range of different mental health disorders and difficulties, from depression, anxiety through to sometimes psychosis. Mm-hmm. I also do ad hoc assessments for people that have potentially need to be admitted to hospital under the Mental Health Act, mm-hmm. which is what the Section 12 is that you're referring to. So I'd get called out and I'd help to assess as to whether someone might need to be admitted into hospital, potentially against their will or using a section of the Mental Health Act, mm-hmm. commonly known as sectioning someone. Mm-hmm. Where there's a process, it's not just me, there's a process for that, but I'm sometimes part of that process.
And you're also on the board of advisors at the Dr Yusra clinic. And part of your work there at the clinic, alongside some of the psychologists that work with us, was to help when we were treating patients with psychological concerns who may need a psychological referral, mm-hmm. Or who may pose risk to themselves. And helping with creating a framework that doctors across the board in the aesthetics field can use when assessing patients. And you started something called Aesthetic Mental Health Service, is it? Tell us a little bit about that.
So in working with you and in the clinic, it became quite evident that actually separating people's journey in a clinic, like going to, for aesthetic treatment, and separating that completely from a psychological process, didn't make sense. There were obviously a lot of overlaps between the psychological drivers that made people want to come and seek treatment. And so it made sense to me that we should develop some tool that clinicians can use that would allow clinicians to assess whether there are drivers such as appearance-related anxiety that might be at play that are contributing to people coming to see you, and potentially screening for other things such as body dysmorphia that may be a contraindication to receiving treatment.
So I think appearance anxiety, I'll leave you to define that from a psychological perspective, but I think appearance anxiety is something that almost every patient will attend with having, is actually normal to a certain extent for the cohorts of patients that I see in clinic. So I often say that the aesthetic treatments that we do are not skin deep, and patients who come seeking reconstructive work in particular, and even sometimes rejuvenation, seldom come for vanity alone. And actually it forms part of their wellness strategy because their aesthetic appearance might hold them back, mm-hmm. or they might have anxiety about it, or they might have been bullied about it, about a certain feature. And I see this a lot, particularly with patients who are suffering with acne, or those who have, for example, a dorsal hump deformity on their nose, and they've grown up with comments from friends, school friends. I don't know how good those friends are, but people around them, sometimes even family, and that can go into adulthood. And these are the type of things that you don't often forget. So patients will come and say to me, when I was younger, I was called Pinocchio, or I was called Concord, and really wild and horrible words that have that impact their self-esteem negatively. And then they have appearance anxiety. And so they come in and they say to me, I hate it. I won't wear my hair down because of it. I cover my face with makeup if they've got acne. I won't take photos. I won't be in family photos. And they're conscious about meeting new people. And that, to me, is how I see appearance anxiety manifest in my clinic. And there is a differentiation. There's a difference between body dysmorphia and appearance anxiety. And I think that differentiation is really important to make, but isn't always the easiest for clinicians, for aesthetic practitioners. So tell us how to make, from a psychiatric perspective, and your expertise and experience, how does one properly make that kind of distinguish between the two?
Yeah, you're absolutely right. The appearance-related anxiety is going to be driven often by a personal experience about something that they perceive, something that they perceive about themselves that is based in some truth. So the deformity might really be there. The idea that they may have been bullied about said deformity or had comments throughout their life, which has influenced how they perceive themselves in a significant way. Body dysmorphia is different in as much as there often isn't a perceived deformity, or if there is any kind of abnormality,
there isn't a physical deformity.
Not a physical deformity, or if there is, it's very small, whereas the patient sees it as extremely large.
Mm-hmm.
And so it comes down to the clinician being able to ascertain, is there actually something there that is noticeable,
mm-hmm.
that may impact how someone is seen or how they see themselves. And then with body dysmorphia, there's other features as well, like how they may be constantly seeking other people's opinion about their appearance, constantly maybe seeking opinions, clinical opinions as well,
mm-hmm.
From different clinicians, requesting an endless amount of treatments, because when there is no deformity, it's very difficult to treat it. And so often you'll find that someone might have come in having seen 10 or 15 different clinicians for 10 or 15 different procedures. And that should probably be a slight alarm bell that rings that says, well, hang on, so let's just assess here what's actually been done, what's the journey been. And at that point, it's worth doing a proper screening for body dysmorphia.
How do you do that screening?
So, well, our tool, the Appearance Anxiety Questionnaire, predominantly screens for appearance-related anxiety. So, does the
So the tool differentiates between if a patient is coming to seek treatment for vanity alone or for appearance anxiety, and appearance anxiety is actually a diagnosis.
Yeah, so appearance-related anxiety would be when a patient has more than one domain in their life that's been impacted by the deformity or kind of the thing that they're not happy with in their appearance. And that's very important for the clinician to actually weigh up and measure. Is the kind of what they're seeing from the score on the sheet, does it correlate with a clinical picture of what they're seeing, and kind of with the face or whatever the patient's come to seek treatment for? So there's no single questionnaire that will kind of identify everything for everybody. It's a questionnaire that helps to give an overall picture for a clinician, but it's very imperative that a clinician's clinical skills and judgment make up a part of that overall
So this
picture.
This tool talk to me about this tool.
So the tool would be at the point of entry. So as someone comes in to seek treatment for the first time, a clinic would ask a patient to fill that in as part of their overall paperwork for coming into the clinic for the first time. And at that point, they'll get a score. And that score will give an indication as to whether or not there's likely appearance-related anxiety. And also, as part of that, it might give us a contraindication alert for possible body dysmorphia, because there's a few questions hidden in there that kind of screen for that, which will prompt them, or should prompt the clinician to say, look, you should investigate this further, because if there's possible body dysmorphia, then you probably want to do further screening for that before you jump in and do any treatment. So it gives a fairly clear score that a clinician can use to start to interpret or to understand what might be happening.
So then after that, what would the pathway be for the patient?
So, once the clinician has that, the clinician can ascertain whether or not there's an appearance-related, or can start to measure whether there may be an appearance-related anxiety, and potentially want to involve a mental health professional at that point if they feel that's necessary. But then what we'll then do is we rescreen that patient around 8 weeks after treatment, which then gives the clinician an idea as to whether or not the treatment has actually had an impact on how on the anxiety levels around this perceived. So
this is different. This is appearance anxiety, not body dysmorphia. So
appearance
basically, if the patient has appearance anxiety, then that is not a contraindication to treatment. It is actually something that should be. We as aesthetic practitioners have a responsibility to create a safe and judgment-free zone to treat patients who have appearance anxiety, mm-hmm. because they have the true presence of a deformity. But patients with body dysmorphia who don't have a deformity but believe that they do, it is a contraindication to treat them. Because, of course, if you do treat them, no matter what you do, you will never make them happy, because body dysmorphia is a psychiatric disorder.
Mm-hmm.
And actually what can happen is aesthetic treatments can make that psychiatric disorder much worse.
Yep.
And so the difficulty in practice is actually ensuring that nobody that has body dysmorphia is treated because of the potential to do harm to a patient who does have treatments.
Absolutely. And you're right. It's not always straightforward, and there's always grey areas in the middle where it can be tricky.
Yeah.
Which is where these kind of tools can be hopefully helpful to clinicians. And it's also important to say that it's unlikely that an aesthetic treatment alone would also be the entire answer. You know, someone comes in, often they come in and tell you that they are struggling with their self-confidence, right? And that's been a story that they've had for many, many years, from potentially when they were young, and someone made comments about their appearance, and that stuck with them. You find that fixing that can help.
Massively.
Absolutely.
Massively.
But it's also often unlikely to be the entire solution. And that's why in the clinic, the psychologists and to help with further formulation for that patient, to help them to understand where this has come from, and to process, where they are now, and how to be potentially more resilient, and potentially reframe how they thought of that.
I guess the differentiation there, and the point is the source of the problem. So if the source of the appearance anxiety is the deformity, then often treating the deformity alleviates the burden, and the patient then goes off to thrive. If they're feeling held back in their personal and professional life because of a deformity, be that acne, be that mandibular retrognathia, or an underdeveloped chin, a dorsal hump deformity, once you've treated that, what I found over a decade of practice is that patients come back to me and they say, I don't think about it anymore. So it's the source was the burden, was the feature. But if the source of the anxiety was the bullying or the comments or external factors, and actually the patient isn't really truly bothered by the appearance, but is bothered by the comments about the appearance, then treating the feature isn't necessarily going to take away the problem. And they may need other psychological supports to strengthen their resilience against those external factors, or manage them better. What's your thoughts on that?
Absolutely. And then, of course, as you know, there's the group that's a bit of both, where actually they are bothered by it and they're bothered by the comments as well. And so treating it does help. But then there's the underlying kind of leftover weight from other people's comments that have built up over years, and how they may perceive themselves, that isn't skin deep. And actually people start to take in that maybe me as an individual, I'm not good enough to do X, Y, or Z. And it's not just then about the appearance, although that definitely helps. And that's where it's really helpful to have a multidisciplinary approach to treating patients aesthetically. I think just having a single dimension, aesthetic doctor, I'm not saying that's a bad thing, but surely I can see that the industry is certainly going to have a multidisciplinary approach to treating patients over the coming years.
Yeah, I think that's the professional integrity of understanding that this is part of a wellness treatment. And I think when we're talking about treating the source and grassroots, I think we need to go even further back and look at educating children on bullying and the impact of bullying, because that's...
we have to come back for
another podcast.
Yeah, because I get to see that in my day job. I get to see the impact of that almost every day, and I guess we could talk about that for a long time.
Yeah. So, and to what extent do cultural and societal influences like media or beauty ideals actually create this maybe body dysmorphia? Could that impact the severity or onset of body dysmorphia?
I think it's multifaceted. It's throughout all of our lives, we've seen that at various points, magazines have influenced young people, and that's been quite well documented. when we were young. And then with the advent of social media, it's clear that people will be influenced by people that they see on social media, and the perception that attaining certain levels of superficial targets, whether that be in material targets or beauty standards, may influence them. I don't know that there's clear data on how significantly kind of social media has influenced the rise of body dysmorphia, but at least anecdotally we can see that there seems to be a correlation.
So you're raising a daughter. What would be your advice to anybody raising children on how to speak to themselves and how to manage external influences in order that it doesn't impact their self-esteem or their body image?
Well, first of all, I think at the first few years of life, it's very, very important to make sure that the sphere of influence that the young children have is very well monitored, is as tight as possible, and emphasizes things that are, that we all know to be important. So character being the thing that's praised more than anything else. So with our little girl, I will often tell her how amazing she is as a human, and obviously I do compliment how pretty she is and so on, but that's not my primary kind of recognition of her talents. When she achieves things, when she is kind, when she's thoughtful, get a bigger reaction from me than when she has her head on nicely, which I acknowledge, but it certainly isn't the thing that I emphasize to her that gives her any value. And I do that with our other kids too. And I think that's the important thing, is to ensure that a child understands that they are far more than a set of tick boxes that they should achieve, they should put forward, whatever that means. So whether that's academic performance that some parents might focus on, or whether that's a certain type of appearance that other people might focus on. I think it's all about making sure that they understand that what's really important is something much deeper than that. Much
so
more significant.
If we finish off with your advice to people for self-compassion, what would you say?
Okay.
One-liner.
One line to... I would say, when you want to speak to yourself, you have to be as kind to yourself as you might be to someone that you care about. So I think it's about saying to yourself, if this were my partner, if this was my best friend, and they were coming to me with whatever I had, in my head, would I say, this is the worst thing that you've ever done, you're a worthless human being? Or would I say to them, actually, come on, it is difficult, but you can get through it. It is difficult, but you've got the ability to navigate through this difficult set of emotions. And I think most people would say to their friends the latter, rather than say you should give up and all hope is lost. And so I think it's about learning to speak to yourself how you would someone else, but also understanding that self-compassion is rarely the be-all and end-all or a solution. We're all connected. And a mental health journey or mental well-being journey is rarely a solely inward-looking journey. I think it becomes, part of it is learning about how we relate to others and how relationships can impact us and how we can impact others. And that's the kind of rise to wellness that we can achieve. It's rarely something that someone can do kind of behind closed doors in an isolated environment.
Great. Thank you so much for joining.
No worries.